Influenza is a well-known disease, and influenza vaccination has been around for decades. It's customary to vaccinate old people in the fall before the influenza season. However, there are problems with this approach. Number one, the current regular influenza vaccine does not work very well in the target group of old people. It's just not immunogenic enough. And secondly, it's been recognized in the past several years that there's a lot of burden of disease with influenza in young children. And the influenza vaccines that we are currently using are not efficacious in young children. So we have two problem areas, young children and the elderly, who need a better influenza vaccine. For young children, it's been tried to give the live attenuated influenza vaccine, which is intranasal and in such way an easy vaccine to give. And it's not associated with side effects really, except for in the very young, under 2 years of age. It may provoke an attack of asthma and other consequences. So the vaccine cannot be used in children under the age of 2 years, leaving this important vulnerable population still without a good vaccine. For older children, intranasal vaccine is a good alternative because it's a convenient way to give it. There's no injection and children usually take it very easily. For the youngest one, the problem is that the injectable normal vaccine is not enough immunogenic. Adjuvanted vaccine might be a solution, and this has been attempted and in fact successfully tried. However, there is kind of emotional fear, concern of adjuvants and especially in young children. So this vaccine, which otherwise would be available, has not been licensed in Europe. There are a few countries that have started with a licensor like Canada of this vaccine for children. So probably in the next couple of years we are going to see an adjuvanted influenza vaccine targeted for young children. Healthy adults respond well to normal influenza vaccine. And there's only a question of whether or not they should be vaccinated. The short answer is just take the shot. And that's it. It's so much easier. There are no real problems, there are no important side effects, and the vaccine induces good protection in healthy adults. When we go to the elderly, the problems start again. And here comes the question of the adjuvant. An adjuvanted vaccine, and this is a squalene-based adjuvant called MF59, has been available in some European countries, like in Italy, for more than 10 years. There is evidence that it's better than the standard influenza vaccine for the elderly. Again, there are some prejudice against the use of adjuvants, and the progress has been slower than it should. But we are stuck with this. Influenza vaccination is taken up well by the elderly, but they are given a vaccine that does not work in them. So some change is needed, and in my view the only way to make real progress is the use of adjuvanted vaccine for the elderly. This is a matter of years. It's a slow process, but somehow we have to move to that way. So I am seeing in the future that we have a solution for the young children and we have a solution for the elderly, but this is not so much question of the vaccine anymore. It's question of attitudes and just the introduction of the vaccination.